Well, I'm enjoying the distinct pleasure of having a conversation with a great friend and honored teacher, Professor Guillermo Kreutzer of Buenos Aires. Dr. Kreutzer, we're speaking today about the development of cardiac surgery, and in particular, some of the early developments in the middle part of the 20th century and from the 1950s through the 1970s. And of course, we will talk about your own very significant contributions. But before we go in that direction, I'd like to ask you a little bit about the background in which your career developed. Quite frankly, when we think about the early days of heart surgery for congenital heart disease, people think of Robert Gross in Boston, and they think of Alfred Blalock in Baltimore, and they think of Lord Russell Brock in London. Of course, cardiac surgery developed in numerous places around the world, not the least of which being some very important centers in South America. Give us a little bit of your perspective on the early developments of heart surgery in Buenos Aires and in surrounding areas.
Well, cardiac surgery in Buenos Aires started with Ricardo Enrique Finocchieto, excuse me, who closed the first patent ductus in 1942. Was, well, for South America was a goal, important. Then I will talk about the experience in our country, in my country, in Argentina. We had a second very important surgeon, who was Alfonso Albanese, who performed the first blade thoracic in 1945, and in 1946 he performed the first correction of coarctation of aorta. This was the 12th coarctation in the world. Then, in no more important events till in 1958 started the experience with extracorporeal circulation closing an ASD. Only in 1951, Fernando Tricherri opened a pulmonary valve with a closed procedure. And then we passed to the experience with extracorporeal circulation. During those days, in the children's hospital where my father was the head, was a pioneer pediatric cardiology in all Latin countries, including Italy and France and Spain. He performed the third angiography in 1941, following Castellanos in Cuba. And because in the children's hospital we have no one was a cardiovascular surgeon, and my father wished to solve the problem with the congenital patients, and he sent patients to Hospital de Clínicas with Dr. Mario Brea, developing a program. This was started in 1959, and to the Hospital Italiano, where Tricherri was there, and then followed by Donato. During those days, I started my residence as a pediatrician, with the idea to be cardiologist.